Today we are going to learn about communication. Daily basis, without communication, we can't do anything. So the communication is one of the major part in palliative care. So we should learn how to communicate with the patients. What are the rules? What are the don'ts? What are the verbal communication and non-verbal communication? That all things we should learn. Okay, then only we will think what are the things that will affect the patients for emotional, what are the non-verbal attitudes will affect the patients personally and all. So today we have Miss Preethi with us, who is a medical social worker. She trained in MSW from IGNOU University, and she is a counseling specialist also. And she has 1 year of experience in palliative care. Now she is working under the social engagement department. Preethi, welcome on board.
Thank you, Shiva sister, for welcoming. Now I'll start my topic. Today's topic is on communication. So today's topic is on communication. Communication is so these are some of the topics we are going to look up in today's session. That is, what is communication, need of communication, positive body languages, barriers to effective communication, steps to effective communication, what is good and poor communication, and health listening, etc. So communication is a therapeutic tool in palliative care. In healthcare, as you are all in healthcare, communication, you will be thinking what communication is for in healthcare. But in situation of serious illnesses, communication is one of the most important tools which a healthcare professional can use in giving the patient the information that they need to know before taking the situation in practice. Nowadays, proper communication is not, at some situations proper communication is not effective. In that case, many major legal issues are at present happening in healthcare professional in the healthcare professional. So we'll have a look into what is communication. So communication is an art of transmitting ideas, thoughts, information, and attitudes from person to another. Communication is meaningful in the interaction among human beings. It's what, where, when, how, why, who, in where, whatever situation we are, we have to have a effective communication. Otherwise, there will be problems happening. So, what is communication in healthcare profession? So a patient or a family come to us with many negativities like their illness, their prolonged illnesses. Maybe they may be knowing that their illnesses will be causing them death. So there will be uncertainty, fear, anguish. Many negative feelings will be there in a patient and their family members. So as a nurse, we have our duties to clarify issues, acknowledge their sufferings. So to do all that, we have to have a knowledge of an effective communication and to have an effective communication skill. So we need empathetic communication components like listening for feelings behind words, that while we are listening to a patient's talk, there may be non-verbal cues coming out of their body language as well as from their sitting position. Different non-verbal cues we will be getting, being accessible where you can be reached and when. whenever the patient is in need, we have to be ready to be accessible. Maintain confidentiality. We have to maintain the secrecy, maintain confidentiality, whatever they are empathetically communicating to us. Keep appointments on time. Observe surroundings in patients' home. That's only applicable when we go for home care or for palliative care. Encourage and reassure while maintaining realistic hope. We shouldn't give any false hope to the patients, but encourage and reassure while maintaining realistic hope. Like, we can't say that everything will be all right, you will be all right soon, or you will get well soon. We will have medicine so that everything can be all right. Such negative reassurance should not be given to any patient. Provide information as and when needed. It should be given on time when we have a communication with the patients. Spend adequate time with patient and family. So we will have to spend a good time to have a good rapport building with them. So why communication is important for patients? It helps to express his or her needs or concerns. When they are openly talking to us, they are opening their problems, their sadness, some may not be able, they may be shy after knowing about their illness. Some may be there will be anger, they may be suppressing their feelings inside them, like that. So we'll have to have an open mind to help to express his or her needs. Permit ventilation of feelings. While talking or communicating with the patient, we are helping them to ventilate or open up their feelings. Helps clarify doubts and baseless apprehensions. If they have a doubt or any apprehensions inside their mind, a healthcare professional, while communicating, can clear their doubts during the communication with their patients. Give reassurance and realistic hope. Like earlier I said, you shouldn't give false hope to any patients. Give the patient and family a sense of direction. You should guide them towards the right path. How, if a patient is suffering from a prolonged illness or a life-threatening illness, you should have the proper communication to guide them in the right direction. Help guide them in decision-making process. So you should also be there to help them in making decision-making process, assisting for coping with bad news. For maybe they may be not knowing about that they are going to have an EOL or end of life, or they are going to have a prolonged illness or a life-taking illness. In that situation, it's a duty of a healthcare professional to assist for coping with bad news, to slowly tell them that what they are going to face, what they are going to face with their illness in future, how if it is a life-threatening disease, how long they are going to, if they are in need, how after taking the patient's condition, if the patient is willing to hear the bad news, slowly you can assist in breaking the bad news. As a healthcare professional, what is there in communication? A good relationship with the patients is what we can build with a good communication. That will help to lessen the stress and build trust with the patient you are dealing with. Better understand the impact of illness and quality of life. So each patient's illness is different, and you have to understand and give a better healthcare treatment. Understand patient's thought process. Some may, like I said, some may be shying off, some may not open up, some may have the anger in it. Each patient is unique. So it's your with a good communication only you can understand the patient's mind and their thought process. Understand patients' beliefs, values, concerns, and priorities. Each patient may have their own spiritual beliefs, values. They may have some concerns. They may have some wishes in life, priorities, which can be understood only with an open communication with the patient. Provide required information on diagnosis and prognosis. So healthcare professional, as a healthcare professional, you can provide proper information on what the diagnosis of the illness is, as well as the prognosis also. Better compliance with management. That is, you can help the patient be better compliance with management is what when they will have in a, if it is a hospital situation or if it is in a hospital situation, they may not find it comfortable in that situation. So you can help them, comfort them, and make them comfortable in the hospital situation. So this is what is a graph of a personal communications. So spoken words are only 7%, while most of the communication are through body language and only 38% is through voice tone. So verbal 7% is through spoken words. So whatever it is, the less spoken words are heard less, but communication is more through body language. So we are, even though we are not going to, it is a vast thing. Some of the body languages we are going to look into in communication are eye contact, facial expression, tone of voice, body position, body posture, body space, touch. So as a healthcare professional, you should be comfortable with yourself, be confident and be welcoming to all the patients under your care. So what is eye contact? You should have eye contact with the patient slowly, but make eye contact before you start talking to someone. Without direct eye contact, you won't be able to have a proper communication with your patients. Don't look down when you look away. Rather than that, looking away, look into another spot and they break. These are all negatives. These all will break the contact with your patients. While if you break your gaze, make a gesture or a nod or a sound like no, to understand that you are still listening to what or you are taking care of your patient. Whatever communication or whatever the patient is saying to you, you are listening to you. Your listening will be understood only if you have a direct eye contact. If you break the gaze, at least there should be a nod or some sound should be heard that you are listening to them. This is a good triangle. That is your when you have eye contacts, these are the positions where you will have the good triangle. Inside that is a proper eye contact position. If you have eye contact above the triangle, that is on the forehead part, that means you are not having a proper communication with and you are not interested with what the patient is saying. The same thing happens when you are looking to both sides. That is near the ear part also. That is also meaning that you are distracted and you are not having a good communication with your patient. The next bad thing you can happen is and distract the patient and lose their confidence is when you go below the triangle, that is below the cheek part, is what when they lose interest and distract and become restless with your eye contact. So these are some facial expressions. Can anyone tell which are the good ones and the good facial expressions and which are the bad facial expressions while communicating? Anyone? Okay, one is a good facial expression. Okay, 1 and 3. Okay, right. Thank you, Another Shini, Mamta, all for your chat messages. True. You can see from the facial expression itself that if a healthcare professional is interested in talking to the patient properly, if the healthcare professional is having a smiling face or a pleasant face, but the fourth one can't be because he is laughing. Some of the patients may take it as an offending expression because they may think that you are laughing at them. So that's not a proper facial expression to be having for a healthcare professional, but a smiling face or a pleasant face should be there while facing the patients or while you are communicating. If you have an angry face or a distracted face or a sad face, then the patient will be feeling that they will not, they may not be confident in you and they may not open up freely or talk with you freely. The same thing happens in the tone of your voice. The same thing is there. As you can see, hello. When you are talking to a patient, if you are saying a friendly hello, and when you raise your voice, hello, like that, in different modulated voice, you can talk to a patient, but the patient will, if it's an angry hello or a distracted or a raised voiced hello, the patient will feel that you are not properly welcoming them or saying a welcoming them properly. So they may be getting cut off from you, or they may not be opening up to you properly while communicating. So a smile. There are don'ts and do's. Avoiding eye contact with a patient while communicating. Grumpy or stern voice, irritated tone of voice. These are all don'ts in a communication process. While what are the do's? Making eye contact in this nowadays everyone is behind mask. So through the mask also, like the medical professional, you can see there's a smile behind the voice. Through the mask also there is a smile in your voice as well as in your face and the eyes. It can be clearly seen while communicating to your patient. So make eye contact, smile behind the mask, smile with your voice. These will all increase a good communication skill with your patients. So another thing is body positioning. Anyone can say what is there in the first picture while communicating? As a nurse, you may all be knowing. You can unmute and say also. As a health professional. Okay, Margaret.
Making good rapport with patient.
Okay, making good rapport with the patient. Anybody?
Standing in a position where the patient can have a eye contact also with the caregiver.
Okay, thank you.
Positive body language.
I didn't hear you. Can you repeat it?
Positive body language.
Positive body language, very good. But these three pictures are telling us about three body positioning. As a healthcare professional, if you are standing, look at the patient. He is straining his body position to have direct contact with the health professional. And there is the patient will not be comfortable if a healthcare professional is standing, because he may feel not comfortable. But look at the second picture. The healthcare professionals are sitting down in the same level as the patient, so that the patient does not have to strain himself to have a communication or talk with the health professional. He will be comfortable, he can talk properly with the health professionals. This position is also, even though the patient, there is a hierarchy in the situation, the nurses or the health professionals are in higher hierarchy than the patient. So while sitting, they feel comfortable, but in a standing position, they will have a not a good wrap. They will have some gap or restriction to talk with the health professional, because eye contact is not direct. The body position is such that they are in a standing position. Here in the second picture, they are in a same level. They are sitting down in the same level of the patient. They will have direct eye contact with the patient. So they will have a good rapport building and a good conversation with the patient. The third one is a small child. So what did the health professional do? To build a good rapport, to talk properly, to know the condition of the patient. The health professional is kneeling down to have the same level of eye contact with the child. So that is how a good communication can be done. While standing, if there will be not a good rapport, there will be restrictions between the health professionals and the patient. But a sitting position or for a child, it will be the professional may have to kneel down in the level of the child, so that they may have a good communication or a talk with the patient. This is the next thing, that is body posture. What do you feel about the first one? First picture?
Unprofessional.
Unprofessional. True. Very good. Okay. The first picture tells us that the person, the health professional or doctor, whoever it is not at all interested in welcoming the patient or in a proper body language or proper sitting position to welcome the patient. So he is just in a inferior position, than sitting in an inferior position. While in the second posture, we can see that the health professional is in a sitting straight with a slight leaning forward position, so that he is welcoming and welcoming the person in front of her with a bright smile, so that the patient, the person in front of you will feel comfortable. They won't feel that they are not welcomed inside that room. They will you can have a good communication with that person if you have a good body posture. Here also, the body posture is such that they will have a leaning forward posture. If you lean backwards, what do you mean? There will be a big gap between the patient and the healthcare professionals. But now look, there is enough distancing between the healthcare professional and the patient, but also they are having a good rapport building between them at the correct body posture by talking freely. So they are telling their problems to the healthcare professional openly. There is no there's no barriers that are confronting themselves. There's a good conversation going on between these two persons. Another thing a healthcare professional has to take into consideration is respecting body spaces. As a healthcare professional, there is a limit to entering into the 4 spaces are intimate space, personal space, social space, public space. But a healthcare professional at some times has to enter into the intimate space of a patient as well as personal space of a patient to solve her problems or to understand her. You can't keep away from them and not attend to their problems. So you have to enter into the intimate or personal space at sometimes to have a proper communication with your patients. Touch. Maybe some of you may not be interested in touching your patients, may keep the distance between them, but a loving touch on the shoulder, on their hand may change the feelings of a person. They may feel loved, they may feel comfortable, they may be in their aloneness, in their problems, they may be suffering because prolonged illness or sudden detection of illness that is life-threatening may cause many issues like sadness. You can sadness, which can, if a person is there, if to touch or to feel or to be sit near them, they may feel comfortable. They may have a open talk, or they may open up. They may tell things that they have suffer. They may be feeling that they can't talk to anyone. A touch can change many things in a patient. Any of you can say anything that you have experienced in your healthcare system, a touch or a body posture, whatever, that change the relationship between you and the patient. Any incidents like that you have encountered in your life as a healthcare professional?
They will feel free to tell their problem and they open us. They'll
Yes.
open and they can share us.
Okay, thank you for that sharing. Anyone else?
Yes, when we test the patient, they will be more comfortable and open to share with us whatever their feelings, and they will be more confident with us.
Sometimes a touch can change their entire life because they must be in a struggle that inside their mind, that a loving touch can change a lot.
We have to keep a good rapport with communication and things, no ma'am.
Yes, a good rapport can be built with a
yes,
touch.
we have to build up a good rapport, and sometime with that empathetic conditions, no?
Yes.
And discuss with some things.
They may open up personal, maybe whatever personal things they have, they may, sometimes they may be desiring to wish something in their life that before their life-threatening illness may affect them. They may be desiring something, but they don't have anyone to open up to or tell. Maybe they may be hiding it from their family members. So in that situation, maybe a loving or such a communicative situation may open up to a healthcare professional. A patient may open up to a healthcare professional. Okay, we'll continue with that. So some of the core principles of communication is respect. Each individual is unique. Not every individual is the same. Each patient or each individual is unique and they may have their uniqueness by each individual may show their unique personality and you have to respect it. Empathy. Empathy is that you have to understand their feelings and understand the other person's feeling by placing yourselves in their shoes or in their place. If you you can understand a person only by when they are talking. If you have an empathy towards that person and understands how they are feeling by placing yourselves in that position. Trust. You should be truthful or genuineness should be there while you are communicating with the patient. Unconditional positive regard. That means you shouldn't be judgmental. Consider patient as a person, whatever he is, whoever he is. Some may be rich, some may be poor, some may have problems in their lives, some may be having adjustmental problems, some may have be quiet, some may. So whatever the patient is, you can't be judgmental, but you shall have to accept the person as he is. So these are the core principles of communication, that is respect, empathy, trust, and unconditional positive regard. So now we are going to look into barriers of effective communication. What are the barriers that so the first one is environmental barriers, that is lack of privacy. Maybe in a OP or a small room, they won't feel confident enough to open up or to talk properly. Maybe some big furnitures may be preventing it. Noise distraction. The most permanent thing now happening is while talking to a patient, sometimes the phone may ring, the mobile may ring, which may break the proper configuration or the rapport building that was about to happen, maybe broken with the noise distraction or crowded room or music or something loud being played outside. These are all environmental barriers that happens that stops to have a proper communication. So look, noise, distractions, interruptions in between. Someone may come while talking, someone may enter into the room so that the patient will get diverted, confused, they may stop talking. All these are then barriers related to patients. Some of the patients may not open up to disclose their concerns or what they may be feeling or what they are going through. They won't open up. That is a big barrier between you and the patient. Lack of privacy. You may be talking to a patient in an open area where lots of people may be sitting, where there will not be privacy. They won't be able to open up to tell their problems. Fear of confirmation of bad news. A patient with a prolonged illness or a suffering illness will have a fear of what the doctor or the nurse or the healthcare professional is going to tell them. So that fear will be inside them, which will be a barrier for communication. Fear of treatment being denied if they raise questions or doubts. A patient may have the fear that the doctor or a nursing personnel will talk badly to them or they won't get treatment if they raise any doubts or questions regarding their illness to you. Fear of losing control over emotions while talking or communicating properly, while disclosing their problems, they may lose their control, they may cry out, they may raise their voices. Different patients in the uniqueness have different emotions which they lose control over while talking, and they may fear it, so they won't talk properly or open up to you. Then there is that is jargon of medical speech that like carcinoma, different terms that is medical, which a normal person or an ordinary person won't be able to understand if you use it in your communication. Simple terms can be used, but a medical term can't be understood by a common or an ordinary patient that is sitting in front of you talking to you. So you yourself may be a barrier. The first thing is what I have not mentioned in this is that your uniform, your dress, these are all barriers that keeps them aloof from you. The stethoscope or the uniform or yourselves may be a barrier to a patient sitting before you, because they may be afraid of you to talk with your uniform. You may be having that stern or not a pleasant face or a friendly face to the patient who is sitting in front, who is talking to you. So that is itself a barrier. Concentrating only on physical tasks, that is on taking their medical vitals, on giving them medicines at times, but not a friend. You may not be having a proper communication with the patient, making assumptions or judgments. You may be making assumption or judgment. Oh, such a patient, he is not cooperative, he is not willing to take treatment. Such assumptions or judgments should not be made. That will be a barrier between you and the patient. Lack of training or experience, knowledge and skill. You may not have that experience or knowledge or skill to have a proper communication with the patient in front of you. Your appearance, like I said, your uniform, stethoscope, all will create a barrier between you and the patient in front of you. Facial expressions, like I said, if you doesn't have a friendly or that stern in your uniform, you may be having that professional expression that may be your barrier between you and your patients. Worried about being blamed or fear of worsening the situation. Some of the patients may be afraid that you will scold them, or they will not get proper treatment if they have if they blame or have a questioning attitude towards you. Unfamiliar with language and dialect. You should have a proper communication on the language a patient is able to understand. You should talk to them in the language they have to understand. If you are talking to them in an unfamiliar language that they can't understand, then there will be a barrier between you and the patient. So these are some tactics that some of the healthcare professionals use that stops having a proper communication with the patients, that is categorizing or labeling a patient. Oh, she is a breast cancer patient, he is a difficult patient, we can't handle him, he won't take the medicines on time. Such categorizing or labeling should not be done by a healthcare professional. Next thing is paying selective attention to say physical aspects. A patient is saying, doctor, I am so worried, I can't sleep properly, I also have pain in the back. The doctor have a single monosyllable conversation telling, oh, tell me about the pain. That means the patient will feel, oh, the doctor is not interested in what I am saying. He is just hearing it for the sake of hearing. So there will be a barrier a distancing between you and the patient. Another thing is never inquiring beyond the physical. How are you feeling? How have you been coping? Just a question that comes in that is inquiring way. That is, how are you feeling today? How have you been coping? Nothing. They are not going deeply into the patient's problems or making an effort to communicate with the patients deeply so that there will be a distancing between you and the patient. The next thing is using leading questions. You should never use leading questions. Your pain is this better, isn't it? Then what will happen? If you ask a leading question like this, your pain is better, isn't it? What will happen? What will the patient say? Will she be opening up or communicating properly?
No, it can be as a single word like yes or no. They'll not explain it completely.
That's a correct thing. It will be just a murmur or a yes or no. If you ask a leading questions, that will be the answer from a patient. The next is using closed questions. Do you have pain now? That's also you will get only a single answer, yes or no. Sometimes they may open up, sometimes they won't. They won't even, sometimes some patients won't even tell that how much pain they are in. If you ask such a closed question, do you have pain? So premature normalization is like, don't worry, anybody in your position will feel the same. Like we are declaring, we are telling the patient that it's okay. In your condition, it will be like this. You will have all these pains, you will have to undergo these things like that. Prematurely declaring it won't be proper way. There will be a barrier between you and the patient. So now we are going to look into steps to effective communication. So the first thing you have to build with your patient is a good rapport building. That is, a good personal relationship should be built with your patient to have a good rapport. Then open discussion. That is, talk with them, sit with them, have an open discussion, understand their problems, gather the information, whatever they tell to you, then understand the person's perspective. You should understand what the patient is expecting from you, what they want to get from you, what type of treatment or what type of care. Yes. Okay. What type of treatment or what type of care is expected from you. So share information, give them proper information about their present conditions, talk to them openly, tell them the truth slowly, not the false informations. Arrive at an agreement on problems and plan. Talk with them, understand their problems and give them chance to look into their future and arrive at to take what to do, what has to be done if in future in a patient suffering with many problems. Close discussion sensitively. So there should be ending to all the communications you have done by closing the if they are saying something personal, if they are saying something very intimate within them, then you should close the discussion sensitively, and then the rapport that you have built between you and the patient should not be broken. So good versus poor communication. It can be classified into verbal do's and verbal don'ts. non-verbal do's and non-verbal don'ts. So let's look into what is. So verbal do's are greet the patient and the family in a warm manner, introduce yourself, ascertain the identity of those present. Whoever is sitting in front of you, ascertain their uniqueness, their characters, whatever is, whatever a person is sitting in, you have to identify them. Use open-ended questions, encourage the patient to speak openly. Repeat important information back to the patient for confirmation. That is, you have to paraphrase it or ask them, repeat the same question in a questionable, open manner to the patient for confirmation. Use empathetic statements when there should be empathy in your answers towards the patient. Use pauses when appropriate. You should stop. You should have a nodding gesture or a sound that is communicated to the patient that you are listening to them, so that the proper communication will be happening between you and the patient. Be honest about information to be given. You have to know what information, and that should be truthful. You shouldn't hide anything from the patient. Verbal don'ts. That is again, avoid medical jargons or vague terms that is not understood by the patient, like carcinoma or edema, like this. If you say that it's a swelling in the knee or swelling somewhere, they can understand. But if you say if it's a cancer, they will understand. But if it's medical jargons or medical terms, many of the patients won't be able to understand what you're talking to them. Avoid inappropriate humor. You shouldn't laugh at what the patients say or make joke at them from while having a conversation with them. Avoid ending the conversation suddenly. You shouldn't have suddenly end a conversation or a talk you're having with your patient by saying that, oh, I have like I said as earlier, sudden a call may come in between that may break the conversation, or somebody may enter the room that may break the conversation. So avoid ending the conversation suddenly. Avoid comparisons also. You shouldn't compare the patient in front of you with another patient, or you shouldn't tell the patient that so and so has undergone such a situation. So you may also undergo such a situation. Such comparisons should not be done while communicating. Do not give premature assurance or false assurance. That is, don't give any false assurance. Do not ask leading questions. Non-verbal do's are always while communicating, there should be eye contact, pleasant, warm facial expression should be there. So the person in front of you feel welcome. Leaning forward, that is the body posture should be in a leaning forward position. Respecting the patient's need for personal space, you should respect them, but in case where there is needed, a health professional can break that personal space. Smile and touch, use it carefully and appropriately, and listening to a patient's what they are communicating to you, listening properly and understanding it is a non-verbal. From their body posture, from their expressions, from what their facial expressions while sitting, how is their body posture, what they may communicate, from what they are talking, you may not understand, but from their non-verbal expressions, you can understand, or from their postures, you can understand more and about what the patient is communicating to you. There are don'ts and non-verbals also, that is, do not stare at the patient. I have shown you that good triangle, that is but other than that, do not stare, do not break into the patient's comfort zone. There should be a space between you and the patient. A comfortable space should be created, a comfortable zone is That will keep the patient comfortable. Avoid unwelcome facial expressions. Avoid indifferent, angry tone of voice, even if the patient displays indifference or anger. Understand the patient, what she is going to. In that situation, that patient may be suffering from anger, suffering from sadness. She may cry out, she may not behave properly. In that situation also, a health professional should control their anger or understand the patient so that a better communication can be done between them. So, listen. It should not be passive. Listening should not be passive. That is non-interested listening should, but it should be active. We should be actively listening to what the patient is communicating to us. If it doesn't do that, it will be passive and we may be losing some of the communication, some of the rapport building that we have brought between us and the patient. Use open questions like how are you? How can I help you? That will open up the patient so that you will have a friendly approach towards your patients. Do not interrupt while they are communicating to you. Factors helping in active listening is simple language that the patient can understand. A nodding, a friendly touch, a loving touch, clarity in responses, how we reply back to them. Like they should feel that we have listened properly to what they have communicated so that the reply should be proper, reflecting back. So we should reflect back reflect back to what they have told by small replies by rephrasing what they have told to what they have communicated to us. Lean forward, paraphrasing. That is a short summary of what the patient has told to us should be given back to them by paraphrasing so that the communication will be complete. So, communication is key to successful relationship. That is whatever field you are, good communication will have a good relationship. That is there even though in a healthcare professional, a patient is coming with lots of negativism, but a good communication can help them. Active listening is key to successful communication. So listening should not be passive, but it should be active. Talking more than necessary is barrier to effective communication and effective listening. So without listening to what the patient is saying, without giving them time to communicate with you, you continuously talking to them will create a barrier in between you and the patient. So, in a healthcare professional, in some situations, we have to say no. We have to tell them that like when you have to tell truth to them. In knowing what, in some situations, you may not be able to tell them proper thing. A truthful answer can't be given to them. In that situation, it will be helpful to say that I don't know what to say to you. I will ask someone, I will get in touch with others and will let you know to reach out for help. It's okay to say no. It's okay to say I don't know in some situations. It's okay to reach out to your seniors or to your colleagues for help in some situations so that you can have a proper communication between your patient and your patients in your care. So this is Rajagopal sir, and according to his words, it's easy to destroy somebody with a few words, but it's also easy to lift somebody up from the depths with a good communication. So I end up my class here with these words from Rajagopal. Thank you.
Thank you, Preethi ma'am, for the session. Anybody have any doubts on this topic, please ask. So nurses are spending more time with the patient, so. Okay.
Hi, ma'am.
Yeah.
I have one situation here that I faced last time. Like when I first entering the patient's house, right? It's like the patient's family, they all are very anxious, and then they will keep asking a lot of questions. But when we are about to like talk to them or answer their question, right? Then it's like halfway we haven't finished our sentence. Then they will asking again or talk again on their own. So like in this kind of situation, what should we do about our communication?
So you feel uncomfortable in that situation when they continuously were talking to you and you were not able to talk with the or communicate with the patient and their family. But but we have to understand they may be anxious enough to, they may not, it may be your first visit to, was it your first home care visit to them? First visit, first home care visit to their house?
Yeah, to their house.
Okay, that means they may be anxious, they may not be knowing for what you are coming in. So they were anxious enough to tell you all their problems. But there comes the part for you to have an active listening skill. That is to listen to what all they are saying. Be calm, you should listen to what they are saying. You should, that is what I said, you should not interrupt in between while they are communicating. So you should listen to what they are saying and then you can communicate back and reply back to their queries and take care of the patients by being a friendly. Expressing their concerns can be solved by you after listening to them properly. Without listening to them, if we interrupt in between, they may be thinking that you have come just to have a medical visit, not to have a friendly visit. They may not be accepting you. They may feel they may not welcome you into their house. After listening, sitting with them, talking to them slowly and taking time only, you can build a rapport with such families. It will take some time. After hearing all their problems, spending time with them only, then you can have some rapport building with them.
Okay, thank you, ma'am.
Thank you, Preethi, for your answer. So I'd like to add a few things along with this previous point. So let me ask one question. We are all nurses, we are medical professionals. So if one of our family members has developed a life-limiting illness like this, so what is our emotions? Do we anxious? Definitely. Definitely we will anxious about what is next. What is happened to be next?
So Shiva, can you put your microphone more closer to your mouth?
What about now?
Yes, better, ma'am, better. You can continue.
Yeah. Yeah. So here, just I am asking you, we all are the medical professionals, we are working. We all know that some kind of conditions. If one of our family members has developed this kind of life-limiting illness, so what is our emotions? Do we anxious? Definitely. We will anxious about what is next, what is going to be next. Is the treatment is beneficial our loved ones are not benefited. These kind of emotions always there. So when we think about a non-medical professionals, like maybe a poor family, so they are also anxious about the same conditions. So when they meet a medical professionals, especially medical professionals, they will have a lot of questions. They will ask you, so what is next? Is there the medication is benefit? These kind of things will be there. If 3 family members there, the 3 members will be asking so many questions. One by one, they will ask. What you can do is to listen. First, you have to listen and then find out what they anxious, why they anxious, what is the problem. You have to identify first. If you want to identify the problem, you have to be a good listener. If you listen well, definitely we can find out the problems. We can encourage them to talk again, and then we can communicate well, and then based on their problems, you can give some suggestions. And also you should understand that why, when we say no, when they say I don't know. So if you don't know any prognosis or any diagnosis, you should say like, I don't know, let me ask the doctor, I convey to you. If you don't anything, please don't give a false hope to the patient. Sometimes we may say like, okay, everything will fine, everything, I hope your the disease will cure. These kind of the simple positive words you will give sometimes. But after a few weeks, just think about that. After a few weeks, the curative treatment is not benefit to the patient. The situation, the disease condition is that worsening, and then they will not respect your words. They will not believe your words also. Okay, if you don't know anything, please say, no, I don't know anything. Let me find out with the doctor and let me consult with the doctor and convey to you. That kind of things. But you have to be a good listener. That is the important things you should learn today. So you should be a good listener. Any other questions? I hope your question is cleared. Any more question, ma'am? Anybody else? Suraya, ma'am, do you have any questions? Before moving on to the case presentation part, I would like to highlight few things. The step for effective communication, already Preethi ma'am had took the points, but I would like to highlight the first important thing is build a relationship. That is one of the most important part. So how should we learn how to build a relationship? You have to introduce yourself and ask them. So otherwise they don't know who are you and all. So you have to introduce yourself and make a good rapport with them. Okay. And also you have to keep it in mind, open the discussion. You have to encourage the patient to talk well, and you have to share the information, whatever you know, you have to convey. Don't give false hope to the patient. Understand the patient's perspective, and also you have to share the information well. And another important thing is You have to close the discussion sensitively. That is also very, very important. And also you have to keep it in mind what are the do's and what are the don'ts, what are the non-verbal expressions that all will be affecting the patients. They will, the most important the part of communication, the non-verbal part is the major thing. While we communicate, the non-verbal, the thing is we use that important the frequently. But if you while we communicate, if you do some non-verbal expressions like tone of voice and posture and eye contact, that kind of things will be affecting the patients emotionally. That time they might be thinking like, okay, they are not understanding my problems. They just come and listen, and then this is their duty. So if you think about their side, always you have to work with an empathetic mind, because what is empathy? Empathy is putting yourself into their shoes. So that is an important part. Whenever you talk to the patients, you have to be a empathetic, good listener, and be a empathetical mind person. So then only you can able to go communicate well and find out the patient problem, and also you have to give some suggestions for the problems. Okay, so these are the important things you have to keep it in mind while we communicate with the patient. And we can move on to the case presentation part. Sister Margaret Sharma will be presenting a patient story today. Sister Margaret, over to you.
Hello. Hello.
Yeah.
Good evening, everyone. Good evening, everyone. I'm Margaret Sharma. I'm staff nurse from Prem Seva Hospital, Uttaraula, that is in UP. My topic is wound care, congitating wound care, and my patient is 55 years old, male patient, diagnosed CA buccal, right side, and presenting complaints is he has big edema on right side of the face and pain, intermittent pain, and pain score is 4 to 5. When he is eating or chewing or dressing time, that time he has 5 pain, 5 out of 10. And he has complaining, and we saw the patient first time. He has very big wound, large wound, and very gap is there, and he has drooling of saliva and bleeding sometimes, not regularly, very mild bleeding when he has when dressing time and he's eating time. That time is very mild bleeding, and patients having difficult to eat and chewing, and he has maybe the pus is there inside. That's why patient is having nausea and vomiting, and he can't eat properly. He has a complaint of constipation. Yeah, and the history of illness, we'll see. Patient is diagnosed 24th August 2020. He has history of consuming tobacco and gutka since 5 years. And after that, he has 2 years back, he has small ulcerative wound arise right side of the cheek. And that time he has pain and difficulty eating and opening the mouth. And he went to local doctor, so nearby his village, and they give some pain relief analgesic something, and he doesn't relief with that medicine. Then he went to that doctor, referred to higher center, and all the diagnosis done. Then they posted for surgery, but same time he has an MRI report also. That report showing the brain, left side of the brain, they have he have some benign tumor, and because of that, doctor did not cancel the operation surgery, and patient having large fungating wound with the edema since 1 month after they came home, and maybe the patient is I think third stage, and they are they didn't do surgery. That also is there, and last 1 month he's having pain and difficulty to eat and talk also, and same time patients is having mal order with maggots. When we visit that day only morning, his daughter called us. He has some maggots came, and then that time we are moving only his house, and is not taking any solid diets. He's taking liquid diets only. The examination, I found that patient is oriented, but patients look very distressed, and vital signs are stable, no fever, and pulse rate 84 per minute, respiration 28 per minute, BP is 100/60 mmHg. Patients, he has pain while speaking, and he's putting mask over the face and that home side, right side, and inside that he put some dressing, and the respiration, respiratory system is we check with auscultate. Patient is having mild wheezing, and CBS is normal, GI is soft but complain of constipation, GU is normal, skin is pallor. And treatment and significant investigation, MRI report, intraventricular meningioma with the calcified nodules in left frontal lobe, biopsy reports, squamous cell carcinoma, CBC, HB 10.6, TLC 6,300, neutrophil 78, lymphocyte 18, platelets 2,20,000, MCB 18.6, and RBC 3.38 million cell per urine, and SCT 29.2%, prothrombin time is 17.7 seconds, serum urea 31.0 mg per dl, serum creatinine 1.20 mg per dl, serum bilirubin total 0.80 mg per dl, direct 0.37 mg per dl, SGOT 22.6 IU per liter, and SGPT 29.3 IU per liter, sodium 135.1 mmol per liter, serum alkaline phosphate is 209.2 IU per liter, potassium 4.32 mmol per liter, plasma glucose random 132.9 mg per dl, and wound dressing daily with normal saline, apply metronidazole crust powder. Psychological aspect, psychosocial aspect, the patient married, wife died 2 years back. He has four children, 3 sons, 1 daughter, all grown up, and 2 are married and living separately, living in a 2-room semi-concrete house with 2 unmarried children. He was working as a daily wage laborer, both sons providing financial support with him, and they only support all the treatment and all, and difficult to communicate due to wound, very large wound, and patient
Sister Margaret, can you hear us? I think she lost her internet connectivity. We can wait for a couple of seconds. She will be joining us back.
The psychosocial aspects of this patient. He is anxious about his condition, impacts on family and social isolation. Next. So medication, tab Ultracet 1 SOS, Ultracet is tramadol, tab rabiprazole 1 BD, tab celecoxib 200 milligram BD, tab methotrexate 15 milligram weekly once, I think, tab over 100 milligram PAD, tab ferrous folic acid 1 BD, tab vitamin D1 OD, betadine gargle, a mouthwash, I think, augmenting 625 milligram TID. Next.
Ma'am, Sister Margaret have joined us.
Okay. Okay. Sister Margaret, over to you.
I doubt whether her audio is connected with us.
Okay, we can wait. His main concern was communication difficulties. He has CL buccal mucosa, communication difficulties were there, and wound care, maybe because of malodor, huge malodor present, this kind of wounds. So malodor is one of the important concern, and social isolation impacts on family. The family is also affected with this disease, and family support, diet and difficulty in food intake. So these are the important concerns for this patient. Next.
Sister Margaret, can you hear us now?
Yes, ma'am.
Okay, perfect.
Yeah, okay.
You can continue.
But that screen share is not coming.
You are not able to see our screen?
Yes, yes, ma'am.
Can you scroll the phone screens to the left or right? You will see the slides.
Yes.
Okay, perfect, ma'am. You can
Yes.
continue.
Now the main concern, we'll see. Communicable difficulties are there because of the large wound, and wound care, because we did the dressing that time, and we teach the daughter and son also is there. And first that daughter told no that Maggot came. Then we asked for the turpentine oil. Then we applied turpentine oil. After 5-10 minutes, the lot of 25-30 maggots came out, and we after that we did the dressing with the normal saline, and we apply the flagyl tablets. That time we teach the same time the relatives also, the daughter, and then that we saw the very difficult, no, because so foul smell, and they are not the medical person, and they are very young also, and we teach whatever we have, and we think we provide all this in dressing pad also, and that also is very concerned how they will do. Then we repeated how they learn or not. Then next day also we asked, then they don't know Maggot came that day only, and then patient, because of that, he is in one small room, and he has social isolation. No people are coming and talking with him because of the thing. No, in village so many taboos are there, and the impact of family. Family support. I didn't see anybody in here. Only that son and daughter is there. The elder brothers are out of station, and they have health problem, and diet and difficulty. Diet also he can't take the all this food and all. Only he can take the liquid like dal and all these, and it's a difficulty in food intake. If he's taking also, it's very big gap is coming out, and all these things are very concerned about that, how to give care, because village setup. Yes. Yes. Next, and summary. 56 years old widow living with his grown-up children. Two already married. Daughter is marriageable age, and one young son is there, diagnosed with a CA buccal lesion that is ulcerating, producing wound with the greater like appearance and malodor, pain with the bleeding during dressing or eating. He feel very depressed due to disease process and inability to communicate people and relatives, family members, son and daughter also with family member, as well as the relative caregivers. Then we'll see the discuss point. How to address the communication problem associated with the patient, and provide palliative care care away from hospital at remote village through home visit, improving quality of life, reducing psychosocial problem. And thank you.
Thank you, ma'am, for the wonderful presentation. So anybody have any more clarification regarding this patient story, please ask them. Otherwise, we can move on to the discussion points. So I hope the presentation is clear to everyone. We can move on to the discussion points. So to you, Preethi. So we would like to hear from you all first. If you have seen these kind of patients in your settings, how will you help? Please give one suggestion. Each one of you, please give one suggestion, so that will help to Sister Sharma to help these patients. Please give your suggestions.
Ma'am, like we have given that our patient was able to read and write. So we gave a writing pad and pen. So in that own language, he was writing and he was showing. So that was one better way to communicate. So we did that in our setup.
Yes.
Hello, ma'am.
Yes,
ma'am.
that is true. So that is
Yes,
true.
ma'am.
If the patient is having a head cancer, most of the time they were not able to communicate very well because of this kind of wounds. So what you can do is, if they are able to write down their problems, we can give a sheet of paper and ask them to write down their problems. So if they are not able to write down their problem, then you can that go with their facial expressions and non-verbal expressions. So that kind of things you can do.
I think that keeping touching with the hands and give some body touch like something, and with some eye contacts, and especially we had a patient in communication, poor communication, the native languages we can't communicate with him, and he can't write and read anything, and just we manage with that patient. We kept that patient happy with that touching, and always we are talking with that patient with the hand, holding the hands, and like that. I think that that our patient was very happy, and with that our setup we had that.
Yes, we did that all things because patient can write and read.
Yeah.
And I'm also thinking maybe we can suggest, like when we communicate with the patient, ask the family members to be around if can, so they may be able to understand the families, the patient's face expression more familiar than us. And then when we are asking patients question, if let's say patients still able to respond, maybe we can, I'm not sure whether in this situation, can we use the leading question to like lead the patient to, like, by noting his head, or telling us yes and no to answer his condition more.
Thank you. Sister Margaret, one question. to you. Did he knows the diagnosis and prognosis?
Yeah, he knows that.
Prognosis
Diagnosis
also.
is not sure. Maybe I asked the daughter is very smart. Then I asked her, but prognosis he is not clear.
Okay.
He don't know. He don't know.
So, anything, Preethi ma'am, you want to add?
Ma'am, next day we call him.
Yeah.
The exam is reduced, and they consult with their consult their family doctor. Relative something is there, then they told about all these things happen. No, the dressing time I got came. Then he wrote some antibiotic augmentin. Then he's taking
Okay.
augmentin. Next week we went. Patient feel that edema and all totally gone. He looked very fresh and he looked very this one also clean also, not like that what we saw in first day. That is very good thing. We feel very happy and he is also happy and he is talking. Next day, next week we went. No, he is sitting with us and he is talking little bit, and no foul smell, no nothing is there. And they are doing daily dressing with the normal saline. And we told to make how to make home-based normal saline also. We teach them, and they are doing that. And we give some metronidazole tablets, and daily they are putting 3 tablets. They crush and they put after dressing. Now he's feeling better.
Okay.
But it's there.
Thank you for hearing that good words. So thank you for your care and all. Let me ask one question to you all. So how does maggots come?
Because of flies. Flies.
What about others?
Others. That the food contain that particle is there in food.
Any other answers? Others, please respond.
Answer, ma'am.
I think because of the flies as well.
Flies.
The
Okay.
tissues are getting necrosed. The secretions coming out of the tissues.
So thank you for your answers. It's come from flies, house flies. So that is very, very important. If you have seen these kind of patients, you have to convey for proper covering of the wounds. So otherwise, the house flies are attracted with the infected wounds. They may when they touch the wound, they may lay eggs. Within 8 to 12 hours, they come out with the maggots. So that is the way the maggots will come. So that is very, very important. You have to educate the patient and family well for covering the wound. So that way we can able to prevent maggots formation. Okay. So here we have a session on fungating wound. That time we will discuss more about that. Today we were discussing on communication things. Here this patient is having social isolation. How will we manage? So we need to improve the quality of life of this patient and their family. So this patient, at the same time, these patients is having some social isolation. How will we manage that?
We have to give health education and awareness to the community.
Okay, very good. Then
we have to sit and talk with him and listen with him what he want to tell by action or by slowly talking. We have to listen his
yeah. So
problem, what he want to say.
That's correct. So we have to listen his words first. If you feel like social isolation, you have to identify what kind of social isolation. Sometimes the friends will be reluctant to see him because after he has developing this kind of illness, friends will be refusing him. Sometimes the relatives will not come to visit him, and these kind of things will be affecting the patient emotionally, socially, and spiritually too. Because of my illness, nobody wants to see me. And if these kind of, maybe because of misconceptions, if these kind of things there, you have to listen first and identify the cause, and then talk to the relatives or friends, make them understand this is not a spreading disease, communicable disease like other disease. These kind of things, the truth you have to tell them and make them understand well, then they will come to visit him. So that way we can able to that reduce the social isolation. Okay. So whenever we communicate these kind of patients, our non-verbal expression, you have to keep it in mind always, because a foul smell, this is one of the major problem. This will be affecting the patient and their family a lot, because the whole family will be affected. Try to reducing the malodor as much as we can, but at the same time, we have to think about the patient family members too. Okay, so if they have these kind of thing, that this kind of malodor there, whenever we entered into that house, we may feel some nauseated feeling, and some kind of facial non-verbal expressions will be automatically come out. Okay, so when they see that emotions from your face or your body, so they will be affecting emotionally. So we have to very careful before entering that patient family. You have to prepare well and then go to the house. So that is the important message. You have to keep it in mind. From today's session, we will discuss more about on fungating wound later. So now the time up, we will discuss more about later sessions on fungating. Okay. Thank you. We can wind up the session. Thank you, Preethi ma'am, for the